reason that we're working with young people in this project rather than other groups of people was that the ICB, Black Country ICB, had this awareness that they hadn't heard that much from young people, didn't know what they were experiencing, what they needed and so on. So that's something that always really drives us at Co-Create, is supporting people who don't usually get heard to have a voice, and not to speak for them, but to hear them and amplify that voice.
So this is the first time we've engaged with students across our system. So we wanted to do some real co-production work and understand how students, how young people felt about vaccinations. We thought we understood that until we did the full engagement. So that was really important. And really important for us because young people will be healthcare workers of the future, and they'll also be parents and have children of their own. So actually we thought it was a really opportune moment for us to do that engagement and to learn and to understand where children and young people were coming from. I think kind of the depth of understanding that we got through the work that Co-Create gave us, the feedback that we had from children and young people was that they were engaged, they enjoyed it, it was different, it kind of got people's senses going, they really wanted to do that work, and the way that it was presented back to us was really high quality and work that we've been able to take forward.
It was really important for us to just get them talking, just get them saying something in the room. And we did that through movement. We did that through getting people standing up, which was a bit, everyone was, what's going on here? We don't do this. We noticed really, really quickly was that actually people weren't connected to the issue. So we could connect to them through the idea of, just building a little bit of trust in the room that this wasn't going to be scary. And we said things like, you're the wisdom in the room and we're not here to teach you, we really want to hear you.
I think one of the things that some young people might feel is a barrier to them engaging is trust. So being believed after you've picked up the toolkit, it's really important for you to trust what you hear, conversations around other aspects or other parts of the public health sector. But trusting the young people before going into to speak to them, trusting what they say when you're speaking to them is really important.
Before this project, I quite honestly never really thought about the importance of vaccinations. They were just something that happened to us. Now, I believe vaccinations are a crucial part of our medical journey as humans, and we should be aware of what is going into our bodies and when we have had them. Overall, this day has encouraged me to keep track of my own health as a whole and take control of my medical journey. Speaking for myself, I definitely feel more confident to share my opinions on health topics, and I hope my peers feel the same way too. Building a confident youth to challenge imbalances in the medical field, whether from the perspective of a professional or a patient, is so important for positive change to take place.
When the group from Co-Create visited our campus, I was not really sure what to expect because I've always thought that such significant subjects were for the medical professionals, the policymakers. I never thought that a student such as myself would have such an amazing and big opportunity to be able to have a say on how we can spread more information about vaccinations. If it wasn't for this project, I wouldn't have known about how amazing the power of involvement is. And I feel like these are the lessons that I am going to carry with me wherever I go and wherever my career takes me. Thank you so much for this opportunity.
One of the things I'm really proud of with this project is the toolkit. The toolkit is a practical document. It's short and accessible. When we design these things, the idea is always that people who took part in the project can make sense of them and use them as well. We've really enjoyed doing this work with Black Country ICB around young people and vaccinations. If you'd like to have a chat about working with us, then please get in touch.